An historic day in Parliament as the Christie administration begins debate on the National Health Insurance Act 2016. Good evening, everyone. I'm Kishla Adderley. Thanks for joining us. Topping the news tonight, the transformative legislation is expected to pave the way for universal health care in the country and create a healthier Bahamas. Clint Watson leads us off tonight from Parliament.
It is expected to be the hallmark of the Christie administration, the introduction of universal health care through national health insurance, making health care and its services affordable and accessible to all, regardless of their status. On Wednesday, the legislative framework was tabled and seconded in Parliament, paving the way for the landmark system to become a reality. Health Minister Dr. Perry Gomez says fine-tuning the various aspects of the plan and putting all arrangements in place for implementation will continue in the succeeding months. He says the government has spent the past 3 decades researching, comparing, and consulting on how best to implement and finance such a plan.
N.H.I. is perhaps the most significant social initiative to be introduced in the Bahamas over the last 3 decades. And it is certainly one of the major public instruments for ensuring good health in our workers so that they can take advantage of the many opportunities being created throughout the country for economic and social advancement.
Mount Moriah MP Arnold Forbes seconded the bill, saying N.H.I. will bring dignity, particularly to the 200,000 Bahamans with no insurance. In his emotional contribution, he talked about his ordeal with his health and how many who walked that same road didn't make it because of a lack of finances.
While I was able to have some insurance in place, when that catastrophic illness struck, Mr. Speaker, the insurance company was there, but what they do is they raise the premium almost 2,000% to try and disqualify me so that I cannot benefit from what I've been paying for a long time. So this, Mr. Speaker, is historic. Because when N.H.I. Bahamas is implemented, ain't gonna be no raise in your premiums when some kind of illness strikes.
Opposition Whip Dr. Andre Rollins, while noting the opposition supports universal health care, questioned the validity of the plan and the phased approach of primary care services, noting that it will still not address the costs associated with diagnosed diseases and the expenses associated with treating them or undergoing procedures. It was an issue Prime Minister Christie addressed.
I want the member to know that in the introduction or rollout of primary care, concurrent or a companion of that will be an actuarially assessed fund that is estimated to be able to cover specific diseases that can be diagnosed and therefore be able to have a transition to when the full benefits are offered.
Clint Watson, ZNS Network News.